Hi everyone, this is Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. We have here a very interesting case of a patient who attended with an extremely blocked and painful right ear. They informed me that they saw a specialist in inverted commas a couple of months ago, and ever since then their symptoms had worsened. I will explain that in more detail in a moment, so I'll give you the full backstory and case history. Before I do, please do stay tuned for the rest of the video, because I will be providing another update on the current going-ons in the UK about my public campaign about improving the safety of ear care, and kind of talk about some of the updates I've received. And in addition, I've had another whistleblower contact me, completely, obviously, it's anyone who wishes to contact me, this is really important to say, because I know there's a lot of specialists that may want to, especially who are working for the big high street chains. Please be rest assured, it'll be completely anonymous. No one will know that you've got that complete promise from myself, and I'm happy to sign any legal document as well to reinforce that. So please get in touch. You can email at report@thehearclinic.co.uk. So stay tuned, and I'm going to show you that this individual's statement that they sent by email. It's going to be quite shocking, guys. So we'll come on to that a bit later. So this patient actually saw me last July, and it's the first time they've ever had earwax removed, and they were over the moon. They were really, really happy. Since this patient last came, I have increased my prices. So they called a couple of months ago, I think, and because of the price change, and I totally understand, obviously we live in that, it's a tough time, but I've had to increase my prices. I've done it over a year ago, because some of the cases I'm doing now are extremely complex, and it just doesn't, I can't justify charging the same price as most specialists, not least some of these cowboy traders out there. So because the experience was so pain-free and painless for the patient, because it was they weren't aware, they thought anyone they go and see will be the same, because they're assuming they're good at what they do. So this patient actually saw someone. Now, I can't categorically confirm whether this person that this patient saw was one of these lay persons who have never been, who've been trained in earwax removal in a couple of days, if that, without any previous experience. I don't know, and that's because the patient themselves don't know truly. They found someone else online who was cheaper, and they said the website was very professional. It didn't mention their background per se. It's just that they were an earwax removal specialist. So it's a case of another unassuming member of the public, a non-suspecting member of the public, because I would assume that most of the public, if you're arranging an appointment for a medical or healthcare procedure, you would naturally assume that that person has a relevant formal training and background and the adequate training. So this patient went to see this individual, I think, beginning of August, and this is what they said to me. It goes, Neil, it was more painful than when she gave birth to her first child. I think it was the first child she mentioned. So you can imagine, just how uncomfortable the procedure was. But despite the patient telling the specialist afterwards, and they had to stop, but the specialist says, "Oh, that's fine, we're done now anyway." But the patient said, "I still feel blocked." And the person who performed the procedure actually showed a picture of the ear afterwards. Obviously now this particular patient completely thinks that was someone else's ear, it wasn't theirs. Because that was beginning of August, so August, September, October, so we're looking, less than 2 months. Now, there are some cases where I've had patients have to come back in a couple of months, but that's typically when they've got an infection, and really extreme cases. It's very rare, so I can't rule it out. I'm trying to be as unbiased as here as possible. I want to give the benefit of the doubt wherever possible, but I can't rule that out for that reason. But I just don't think this is that kind of case where it's going to come back in a couple of months. And you may have seen this remaining piece of wax is really impacted against the eardrum. It's been pushed up against the drum, and that's what this patient was feeling. It has been rammed right up against the drum. It was like plaster on a wall, or it's impacted. So my gut feeling is that well, that's not the case here. So the patient had obviously paid, and again they were just said, oh, everything will be fine. If you've got any problems, go to your doctor, but everything's fine. We've cleaned the wax out. So this patient a few days later developed some discharge from the ear. Now they obviously went to the doctors, and the doctors said your ears are blocked. I mean, in the defense of doctors, they're not, they are general practitioners, and I know a lot of doctors who are great with ears, and some probably not as good, but I'm trying to defend the doctors a bit here as well, because they have got a lot on their land, but they correctly identified that this patient's ear was blocked still. Now, they weren't sure whether it was wax or an infection. And obviously, there might have been a bit of an infection because there was some discharge there. So they said to the patient, you've got very likely a perforation, which we can't rule out. I can't rule it out, but patient was given different advice from different doctors, which is the kind of the point I was trying to make. I was going to go on to. So they weren't really sure what to listen to, because one said use drops when they've got perforation. These are softening drops. The other doctor quite rightly said if they've got concerns of the perforation, not to use the drops. And so anyway, the patient was given some oral antibiotics, and the discharge stopped, but they still couldn't hear, and there was so much pain. And the patient then contacted us back, and they felt slightly awkward because obviously they previously attempted to book. And I explained to them that we totally understand. Do not worry. We don't, it's fine. We're here to provide a service. So you've got nothing to feel awkward about, honestly. And I understand their reasons. And they just said, like, when they came to me the first time, because it was so straightforward in their eyes, and they just thought, well, that's the norm. Everyone's going to be trained to this standard. So as you can see, we removed the wax from the right side. It was really impacted on the eardrum, and so I used a bit of drops, and we just delicately removed it. There's a bit of residue around the edge. I'm not bothered about that. It's fine, You don't want to risk any trauma to this patient to get a spotless ear. But we're very pleased with that. This left ear, again, they were told it was clean. But they didn't really have an issue with the left ear prior to seeing the specialist. And I think in part because their right ear was so bad, they didn't have that reference point. Sometimes patients come in believing that they've only got one ear full of wax, but when you examine the ear, it's both ears. But because that ear that they've got the main concerns about is so bad, they feel that their better ear, should I say, is normal. And it's only when you remove the blockage from the really, really bad ear, the patient then notices the other ear is blocked and think, oh, I can't hear from this side now. But so this patient did also have wax removed from this side, according to themselves, and they were showing a picture too. Like, everything's clear. But again, you can see it's fully blocked. Now, this patient has really, really itchy ears. You can see there's a bit of superficial otitis externus, a bit of kind of eczema psoriasis at the entrance of the ear, and they're forever scratching the inside of this ear in particular. The right side, it wasn't the same. So I've removed the main blockage. You can see there's a high level of keratin, dead skin contents. When you've got a high turnover of dead skin in the ear, it can either really crust and become dry, or it can become very mushy like this. And this is the worst type of wax and dead skin to remove debris, because it's hard to vacuum. And so I've cleared the ear. The patient can hear now. It's not a problem. But because of their itchy ear, I just really want to clean around the edge. Now, they have got some, again, topical antibiotic spray. I've also given them some other suggestions as well to help with this dry skin. Well, in this case, it's not dry, it's mushy, but this itchy skin. The patient is going through menopause, and if you've been watching my past videos, you're aware that I've talked about a possible link between menopause and dead skin buildup. So patients with menopause can have a lot of dry skin, in the parts of the body, should I say. But I've noticed a high proportion, and it's all anecdotal, it's not scientific, I have to put that right out there, but it's just, for me, too much of a coincidence. So that doesn't mean that everyone who's got menopause is going to get blocked ears. I'm not saying that, but there's a high percentage of patients, female patients, who've had no problems with their ears until going through menopause, and typically it's a lot of itchiness and dryness, or occlusions like this, so kind of mushy dead skin. So what you're going to see now, I'm just going to peel all this dead skin. It's going to be a brand new ear canal. It was a bit difficult because the entrance was a bit narrow. So guys, I'm just going to let you carry and watch this now. I'm going to just using the fine end suction probe. We're just making sure throughout there's no clarinetting. So clarinetting is when you vacuum dead skin, it violently flaps at the tip of the sucker and it emits a very loud high frequency squeal. So we've got to be careful of that. And you can see I've just put some oil in here. So, so guys, I'll let you carry on with that, and I'm going to give you the update. Now, we got a response back from this membership body. So just to brief summary, I've been calling out a particular membership body for accrediting courses that train lay people when it comes to ears. So beauticians, accountants, I've heard of a plumber today, receptionists, that high street hearing chains, and that's the most shocking one. So the high street chains are involved in this, guys. And I published another statement yesterday who confirmed that. I've got another one coming out tomorrow. So, I mean, it's common knowledge in our industry. So, you know, it's probably shocking for you guys, but, you know, it's been happening for a while. No one's really spoken out about it publicly. And I've just had to take them to task now. Enough's enough. So this membership body is a lot of the members on the board are, and other people are saying it, people see it, the optics are there, are employees of these big national multi-companies. So they're trying to push through proposals to have a register of earwax removal practitioners. Now, this membership body is designed to represent registered hearing aid dispensers in the UK, like myself. It is a voluntary organisation, so it's not mandatory, but they have got good links with the actual regulatory body called the HCPC. So there's some benefits in some regards to joining. So there is obviously annual membership fee as well. And so this membership body is meant to be representing us and also your best interest, the public. They are pushing through proposals to allow what we call associate wax members, which basically mean receptionists at high street hearing chains, beauticians, electricians, accountants, hairdressers, barbers, tattooists. I can go on, I literally can. And also other healthcare professionals, but without the relevant ear experience. We've got podiatrists, dental nurses. Now, to become a dental hygienist or podiatrist, I think it's 2-3 years training. Occupational therapist. Now, you can't do what we do this in a couple of days, guys. If you're a complete ear virgin, you can't. It's just not possible. So anyway, I've pulled them to task. They apparently did this poll, which they did do the poll, and they said 75% of members are okay with including these lay people, but they didn't define. They used the term associate wax members. Now, no one really knew what that term meant, and they didn't clarify it. It's only now that I'm bringing it up. So, well, this actually means anyone. So they did this poll, and they said 75% of respondents are happy with this, but they don't know what they were voting for. They also conducted public and other member consultations. However, they've not published the results, and I've been asking for almost 2 weeks now. Publish the results, let it be scrutinised, show all the comments, like they do for other polls and surveys. They publish this on their website, but they still haven't published it. They still haven't explained and clearly defined what this associate wax member is. They just haven't done it. So they responded today saying, okay, they've listened to the concerns of the public and the concerns risen by me. So what they're going to do, they're going to extend the deadline date to give comments to this publication of these proposals that they're doing. Why do they want to extend it? Do they want to hear more public outrage, like I'm sharing your comments with these guys? Do they want to hear more of the disgust amongst members about their even conceiving this idea? So I've written back to them publicly and said, this is not on, no one, you're getting the members really irate now because you're not answering the simple questions. Define what an associate wax member is. Let the membership know clearly what this is, because they don't know. And I know what it is, but we've not heard it from the horse's mouth. And also provide all the polls results, provide the surveys. You can't just put out proposals without showing your members the results of surveys and polls that you've conducted. So I've told them to immediately withdraw the proposals, define clearly what an associate wax member is, provide all the findings from all the surveys and polls, which is going to be void anyway because no one knew what an associate wax member is. Redo the polls and the surveys once all the membership know the terminology, the definition of an associate wax member, and then publish and disseminate all the findings to its members so they can scrutinise and review. And only then and then only do you even contemplate putting these proposals back out there for public consultation. I think it's a boarding crisis, and I know members are furious, and a lot of them are, considering their positions as members. Now, I will have further updates for you guys, but yeah, just in summary, this people are getting trained on only 45 minutes supervised practical training. How about that, guys? Take care, bye.